Hello and thank you for tuning in. I am Paul Ogolla in Nairobi, and I welcome our viewers in Kenya and around the world to On Time News, a program that focuses on a global and exclusive look at issues affecting public worldview in economics, politics, health, and arts and culture. But first, let's have a glimpse of the top stories around the world. Beginning with the first story, Cuban doctors have continued executing their duties in various hospitals in Kenya, even after a court ruling that they should not operate in the country. The same sentiments have been maintained by the Kenya Medical Practitioners, Pharmacist and Dentist Union, that is KMPDU. Moving on to our second story, the Supreme Court of Kenya has nullified election of Ugenya MP, Mr. Chris Karan, and ordered the Independent Election and Boundaries Commission, IEBC, to conduct a fresh election in the constituency. And moving on to our third story, former Manchester United Football Club coach Jose Mourinho is reportedly already attracting interest for 3 clubs after leaving Manchester United. The Portuguese was sacked by United on Tuesday, with the club languishing in 6th position in the Premier League. And now to the globalization. Kenya is one of the World Health Organization's in 57th position among the countries listed as having crisis in shortage of health staff. In 1994, the government imported doctors from Egypt, but a majority of the doctors left just after 3 months because of the difficulty in working places in a broken healthcare system. Kenya's healthcare system suffers from a serious leadership and governance gap, beyond the challenges of adequate personnel and proper equipments. According to the KMPDU Secretary General Dr. Paul Ogolla, Kenya has more than 1,000 doctors who have graduated with degrees in medicine, dentistry, and pharmacy. They have awaited developments since May 2017. An additional 1,000 doctors committed the mandatory professional internship on April 2019. On April 2018. In his view, the importation of 100 Cuban doctors from Cuba will not significantly impact the healthcare system, and neither will it help solve the serious health challenges facing Kenyans. Many critics have been of the view that the Kenyan government strengthening the systems further than focusing on manpower to work on a broken system. The question I'm asking tonight is, are Cuban doctors a solution to the healthcare problems facing Kenya? Are Cuban doctors a solution to the healthcare problems facing Kenya? Join the discussion, or rather the conversation, in our Facebook page, Ogash Pays, and Twitter handle at Paul Ogolla 5, and we shall sample your view before the end of this bulletin. I can see some of your comments are streaming in. Keep them coming. I will sample them in the course of the bulletin. Gladys Soy on Facebook say, we have enough doctors. Those people should be deported back to their country. Up next is a correspondent feature with Faith Kaulu.
It is evident that there is a thick cloud of confusion that has been covering our health sector. Strike after strike by the medical officers, misdiagnosis, lack of proper facilities, fake professionals, half-baked officers, poor pay, among others. From our neighbor's President Yoweri Museveni, speaking during Labor Day celebration in Sembabule, central Uganda, he was quoted saying, "I want to bring Cuban doctors because ours behaved badly and unprofessionally. They started striking, incited other doctors and left our patients to die. They were blackmailing. They are enemies of Uganda who should be treated as such." End of quote. Could this be the reason why Kenya too signed a bilateral agreement that saw Havana send 100 medical specialists in the country?
Okay, so I am not in support of the many Cuban doctors that have come to Kenya because first of all they are gender biased, because firstly the male outnumber the female, and also there are very many language barriers between them and us because most of them can't speak in English or Kiswahili.
When a politician gets sick or a famous person gets sick in Kenya, they go to India. So I would have thought maybe they could have gone to India to get Indian doctors, but instead they went to Cuba to get Cuban doctors.
Ironically, research that was done by the Kenya Medical Practitioners, Pharmacist and Dentist Union (KMPDU) in May 2018 indicates that the number of unemployed Kenyan doctors hits up to 3,000 despite the acute shortages of medics in both private and public hospitals. With this discrepancy, foreign doctors are hired in the country. The leading specialists include orthopedics, surgeons, oncologists, nephrologists, dermatologists, with the aim of doing away with the dependency on referral hospitals. Dr. Nelly Bosiria, a member of the Kenyan Practitioners and Dentist Board, said that the shortage of specialists in Kenya cannot be solved by bringing in Cuban doctors, but by investing in training of specialists. Cuba trains doctors to export for income generation, yet Kenya does not have the luxury of buying such a high-end commodity, which it should be manufactured at home. She proceeds by saying our problem is not doctors, but resources. Now this raises the question, are Cuban doctors the magic cure to East Africa's health sector? Faith Kaulu for On Time News.
Faith Kaulu now joins us live and gives us an understanding on the Cuban doctors issue across the country.
Well, thank you so much, Paul. Now, my interaction with people on the ground has been an interesting one. Lots of stories can be told about the medical or health sector in our country. Now, as it stands right now, there is a lack of trust between citizens and the health sector. Untold stories of misdiagnosis, lack of proper medication, or even shortage of medicine is roaming in the streets.
Now, with the incumbent, or let me say the coming of the Cuban doctors, has it beefed up the health sector, and how are people reacting to that, and even in terms of relations?
Well, that's a nice question, Paul. Now, my interaction with people has revealed a lot, especially in relation to the Cuban doctors in our country. Lots of complaints are rendering people, or rather citizens of the country. And right now, my interaction with people on the ground has revealed a few challenges that are being experienced. One is the lack of proper communication due to language barrier, as it seems Cuban doctors are not able to clearly speak or understand either English or Swahili language. Well, another complaint is that the Cuban doctors, there is a gender imbalance amongst the Cuban doctors, where you find that the female gender is dominating, hence making it unable for them to interact well with the male gender, or rather male patients in the country.
What do you think could have been the government's first priority on this matter?
Well, Paul Ogolla, a lot has been said about this, and I would rather like to make it short and simple. It is up to the government to check into the system, which is the education system of the doctors, because statistics reveal that a lot of Kenyan graduates who studied medicine in the different universities are unemployed. Well, thank you so much, Mr. Paul. Back to you in studio.
Thank you very much, Faith Kaulu, for a comprehensive report. Looking at your feedback, Collins Orono on Facebook says Cuban doctors are not the solution to the problems facing the health sector, because we have enough manpower that we need. What we need is a working health system. Today we are hosting panelists to help us dissect this subject. Joining us now is Dr. Rubery Kipkoech, an orthopedic doctor working in a level 5 hospital in Machakos. Mr. Kipkoech, was it wise for the government to go for Cuban doctors?
I can say it was premature. I think they could have thought about it further and actually made made better plans to even bring the doctors in, because you can imagine in Kenya still we don't have the required doctor to patient ratio. So it's good bringing in doctors, but bring them like when we still have when it's a laid out plan, and then we don't have doctors who can actually prepare without any form of employment.
Thank you, Dr. Kipkoech. We are also being joined by a Cuban doctor, Dr. Nithi Barura, a dermatologist working in Machakos Level 5 Hospital. Dr. Nithi, how do you find Kenya?
At the beginning was different.
Yes.
Because different culture, the language, the Swahili language is different because we know English, but English is the second language that we have in Cuba. But at the beginning was very difficult. But now we can insert in the system here. I consider that I useful in the place when I work.
Thank you. Lastly, we are joined by Dr. Ndambuki, who works closely with the Cuban doctors. How do you find Cuban doctors?
Interaction with the Cuban doctors, and especially the one working in the dermatology clinic, has been a great help to me. She has been able to teach me a lot through an Excel program, whereby we are able to identify the key issues or skin conditions in our country, and she's also able to interpret most of the diagnosis. So through her, I've been able to learn a lot, and she has also learned a lot from the African view of dermatology, where we have been able to show her most of the common conditions that are available in Africa. Through this, we have been able to come up with the right diagnosis and treatment for our patients in the skin clinic.
Have they adopted the Kenyan environment?
Previously, when they came, because of the barrier language, there was that negative impact from the public and also from some of the personnel, medical personnel, that these doctors could not deliver what they were meant to deliver. But currently what is happening, there is a very big impact, a positive impact on the treatment. And they are able to diagnose, they are able to manage and treat our Kenyan patients in a timely and honest manner. So to me, I can say the impact is good and it's a very positive impact.
Was it necessary to import them?
It was because the kind of assistance we have been able to get from the doctor in our clinic is of very great importance, because we never had a dermatologist in the hospital, and her being there, we have been able to do most of the things that we could not be able to do. So to me, it was a good impact.
Thank you, ladies and gentlemen, for joining us. Let's check your say now. Eric Cavo on Facebook says those doctors are doing great, especially in skin cancer diseases and surgery issues. Now it's time when we wrap up our program. It was indeed exciting having you on board. Thank you very much for having had tuned in. But let us continue with the discussion online, be it at Facebook, Twitter, or Instagram. I have been your host, Paul Ogolla. See you then.